Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Public health officials advise that the current 5-day test positivity rate is 0.83%, and 18 new cases of COVID-19 have been identified over the weekend as of 9:30 a.m. this morning. The total number of lab confirmed positives and probable positive cases in Manitoba is now 354. New cases include 11 cases in Interlake Eastern Health Region, 3 cases in Winnipeg Health Region, 3 cases in Prairie Mountain Health Region, and 1 case in Southern Health. Of the recent cases, 10 are from Hutterite colonies, 2 are travel related, 1 is transport related, 3 are close contacts to a positive case, and 2 of the cases are not linked to travel or a known case at this time. All these investigations are ongoing and additional information will be provided when available. One of the individuals announced as a positive COVID-19 case today was a passenger on several flights from Manila, Philippines, to Winnipeg on July 7 and 8. Flight details and row information is updated on their website, manitoba.ca/COVID-19/flights. Individuals in these flights and rows are advised to self-isolate for 14 days following the flight and monitor for symptoms. Passengers on these flights, but not in the affected seats, should self-monitor for symptoms and self-isolate should symptoms develop. Public health assesses the risk to others as low in this situation, but it's sharing this information that people are aware and know to seek testing should symptoms develop. We currently have 1 individual in hospital who is currently in intensive care. We have not had a case in hospital since June 6 prior to this. There are 29 active cases and 318 individuals that have recovered, and the number of deaths due to COVID-19 remains at 7. An additional 384 lab tests were performed yesterday on Friday. 1,390 were performed on Saturday and 695 were performed on Sunday, bringing the total number of tests performed to 76,354. And again, reminding Manitobans that it's not unexpected to see more cases as we reopen. A number of these cases are linked to clusters, which we can also expect over time. But it's a reminder that we can't let our guards down, that we have to continue to find ways to live with this virus, to fall back on the fundamentals that got Manitobans here. Stay home if you feel ill, even if mildly ill. Practice good hygiene. Maintain that physical distancing when you're with people outside of your household. And that's that 2 meters, that's 6 feet apart. And that's what we see as the virus is still here in our province. We need to continue to adhere to these strategies that have brought us so much success to this date. So we know that it's been a trying time for Manitobans. We know that our work has allowed us to reopen to this point, and we're going to continue to do so as the data indicates. But this is a big change in our behavior. We need to be staying home when we're ill. We need to maintain that physical distancing. We need to realize that this virus is not done with us yet, that we have ways to continue to enjoy things we want, continue to reopen our economy, but we must implement those measures to continue to protect the transmission against this virus. So those people who are at increased risk of severe outcomes, those over 65, those with underlying medical conditions, those with immune compromise need to be extra cautious during these times to ensure they're not in crowded, enclosed spaces. And lastly, a reminder again to Manitobans to be kind. Let's avoid stigmatizing people. Let's avoid calling out individuals. And let's work together. We're in this together. All Manitobans have really stepped up, and we truly are in this together. So let's be kind to each other, and we'll continue to get through this. Continue to visit our website, manitoba.ca/COVID-19 for up-to-date information. And I'm happy to take some questions.
Thank you, Doctor. We'll go to the phone first. From City News, Stephanie.
Dr. Roussin, Stephanie Orsic with City News. Just wondering, I guess, hoping to get your impression of why Manitoba is looking to draw some larger scale events here to the province.
Oh, sorry, I didn't catch that last part there.
Just hoping to get kind of your viewpoint of why Manitoba should be the province or should be looking to get larger scale events here.
Large scale events. Well, it depends on what the event is. So if we're looking at events, we'll always be reviewing the detailed plans. Some of these events, if there is an event that is in a bubble format, then we're looking at really no risk to Manitobans, very low risk to Manitobans. There may be risk within that bubble, but if it's within a bubble format with the proper precautions, then our main concern is always the health of Manitobans. And if we can practice in that manner, then we're happy to review those type of proposals.
And I know you said that it's not unexpected that we're seeing our numbers go up, but are you concerned about behaviors that you are seeing? I know you voiced last week that you were seeing more pictures of people not physically distant. Are you continuing to see that, and are you concerned about it?
Yeah, I mean, I think that Manitobans have been through a lot as Canadians and people around the world. Manitobans have really adhered to our advice for some time. So seeing that stretch of low numbers, seeing the nice weather, it's really challenging to continue to stick with the things that got us here. But these cases are a reminder that that virus is still here. That if one of these cases is in a crowded enclosed space, we're going to see a lot of cases. So we have to be on guard.
From the Winnipeg Free Press, Jeff.
Hi, Dr. Roussin. I was just curious on the, what in the CFL's Hub City plan for Winnipeg as part of Palliser's announcement today, and something that the release said you have thoroughly reviewed. What in that plan makes you confident that the league will be able to have hundreds of Americans, some of whom live in Florida and Texas, travel to Winnipeg and not create an outbreak of COVID-19 like we've seen in other sports?
Yeah, so it's the combination of the bubble format, along with the quarantine period, along with testing. So these are not individuals that are traveling to Winnipeg that can interact with other Manitobans. They'll be contained within a bubble, within the league bubble. And again, there's going to be a period of mandatory self-isolation. There's going to be mandatory testing that's taking place in there. And then again, it's going to be all taking place in a bubble. So it's really a plan that takes in the consideration of the health of Manitobans.
Just to follow up on that, it's easy to say that, hundreds of players can stay in a bubble, and so long as that happens, everything is great. The CFL is a much different league than other leagues such as the NHL, the NBA, other places that are doing, I guess the NFL isn't doing a Hub City, but other leagues are. There's a lot more incentive based on the money that the players earn. And, to say it's one thing, promise something is one thing, but to actually ensure, what evidence do you have that the players are going to be held in check in their hotel rooms, and also before they arrive, as we see in the NHL, it has to be three negative tests in 48 hours. I'm looking for specific evidence that gives you confidence, not just saying that you have the health and safety in mind of Manitobans.
Yeah, well, we've reviewed the plan, and it has that period of self-isolation and testing in it. If you look at all of our plans, the plans that got Manitoba where we are, relies on people to adhere to the strategies. So we had a self-isolation order in effect for interprovincial travel for quite some time. And for the most part, we just relied on people to adhere to the regulations. We have the CFL, which has been a partner, which we've worked with their league physician and work with them to provide feedback on their approach to this. And so we're going to be holding them responsible for ensuring that the protocols are adhered to.
From Global, Amber.
Hi, Sarah Mcgusson from Global News. With 10 new cases from Hutterite colonies, is the province doing anything to work with them to kind of minimize the spread? I understand they live quite convenient have already voluntarily locked down?
Yes, so as we started seeing cases, and even before early on in the pandemic, we've worked with the Hutterite Safety Council to ensure we are articulating the importance of preventative measures. Ever since these clusters have developed, we work with the colonies themselves that are affected, and as well as the Safety Council, and we're continuing to work along those lines.
Okay, a separate kind of topic question. We're hearing over the weekend that the King's Head was having to do their own sort of enforcement, checking people's IDs. I don't know if you've heard that story. And they were hearing that travelers were maybe not quarantining. So the question is kind of how are people slipping through the cracks, and how concerning is this that people maybe are coming from areas that are supposed to self-isolate, but they're not?
Yeah, and so, certainly we're concerned about people coming from the U.S. right now and not self-isolating. We're hearing just anecdotal reports of that, but we work with the Public Health Agency of Canada, as well as the Canadian Border Services Agency to work on ways to limit those type of instances. For the most part, we're hearing mostly anecdotal stories, but it is something that we continually look at.
From the Brandon Sun, Kyle.
I was wondering if you could possibly provide any more information about the 3 new cases in the Prairie Mountain Health Region that you just revealed in terms of people, places, anything like that of that nature.
Yeah, we don't have. I don't have any information on that to share. As per usual, we will share any details that we feel would benefit the health of Manitobans. Right now, we're identifying at the regional level, and don't have anything more at this time.
Mm-hmm. And just to follow up, I guess this might be a dumb follow-up question, but there's no evidence to suggest it's connected to any Hutterite colonies in the Westman region?
So I don't know if if any of these have been, these aren't on Hutterite colonies, those 3 Prairie Mountain Health. We have right now in Southern Health and Interlake Regional Health Authority currently is where the clusters are, on 3 different colonies. But I don't have any further details on the Prairie Mountain Health numbers.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. Could you tell us how many cases in total over the last week or so have been linked to Hutterite colonies? And is this something that you would call an outbreak?
Yeah, so there's 20 total cases over 3 separate colonies. And so, yeah, we were, we would determine, call these a cluster, and investigate them and treat them as an outbreak. It's just, typically an outbreak we would define as more than expected, and a cluster, usually if it's a confined geographical area, then we'll often just call it a cluster.
You say there were a few cases that weren't related to a known case or to travel. Which health region are these cases that might come up as community transmission situated in?
Right. So as of right now, I believe that there's 1 in Winnipeg and 1 in Interlake Eastern, and but we can get further clarification of that. And so remember, these are, when we talk about non-EpiLink cases, it's cases that we haven't yet been able to link to travel or to other cases. As the investigation goes on, we often are able to link them. So it's just we haven't yet been able to link them.
From CTV Winnipeg, Jeff.
Well, hi, Dr. Roussin. You talked about, holding the CFL responsible for the bubble system. Being that you would know about it, do you know what the CFL system would be for a place like Winnipeg? Would it be hotel, practice facility, stadium only, or would there be other places players would be allowed to go? Because I don't want to make the mistake of comparing apples to oranges, like it's going to be like the NHL or the NBA. Do you know what the plan would be?
Yeah, and so that's for the most part, it's going to be a bubble, and like you say, it's going to be accommodations to practice and game facilities. Any things outside of that would have to maintain the bubble format on that. So remember that the importance of maintaining this bubble is important to Manitobans, but it's important for any sports event, because if you have cases introduced into that what should be a COVID-free bubble, that compromises even the entire season. So there's a lot of motivation to keep that bubble very tight.
Sorry, I have a clarification on that answer. You say anything outside that bubble you have to maintain. What do you mean by that?
Like, for instance, if there was going to say a restaurant, if that ever occurred, then that restaurant would have to be shut down to the public, so that only the bubble would be able to be in there at one time. And so those would be the type of example I would think of.
Thank you very much.
From 1040 Radio Vancouver, Sorhan.
Hi, Dr. Roussin. Just to follow up on the CFL story, have you got any expectations of testing before players enter the bubble environment, that they'd have to test negative in the United States before they come up here?
Not before they come up here. What they have to do is when they for a period of time, they're going to be self-isolating. And then not being able to have any team events until that period of self-isolation is done and a negative test. So they won't necessarily have to be required to have it before they enter here, but once they enter here, they'll be in self-isolation.
How long is that isolation period?
It'll vary on where they come from. And we're still working on some of the details with that.
At events, so are you anticipating that there will be some form of limited seating at the stadium for all of these games? And if so, what percentage? What would that look like?
Yeah, right now for fans, it's not something that we've discussed. So we have group size limits right now currently in the province, and any attempt to have fans would have to adhere to our public health orders in that regard.
From the Carillon, Nicole.
Hi, Dr. Roussin. This is Nicole Buffy from the Carillon. You sort of touched on it earlier, but some colonies in the western provinces are experiencing a little bit of discrimination for their case numbers. So I guess my question would be, what would you say to both these colonies and people who are discriminating against here in Manitoba for our number of cases over the weekend?
Right, and this is why we mentioned really from the beginning stigma, and it's something that's very predictable with pandemics or outbreaks. At first, we were seeing people from certain countries were being stigmatized. Then we can see certain professions being stigmatized. Now we'll see certain groups of people within Manitoba stigmatized. So really cautioning people, because it just doesn't work. Stigmatizing people doesn't work. It's going to make people less likely to want to get tested, less likely to be cooperative with public health. And so if we just be kind to each other, if we can know that no one wanted to be infected with this virus, and just follow public health's lead, and not stigmatize people, because one is it's just not going to work, and most times it actually backfires. It's going to assist this virus in its spread.
Okay, thank you.
Thank you. And now we have time for questions from the floor. A few questions from the floor. Please proceed.
Could we just clarify, are you saying there's a possibility there could be fans in the stands if Winnipeg hosts the CFL?
That's not been part of our discussion at all. Just hypothetically, if there was, they would have to adhere to our public health orders.
Part of the CFL's proposal, and you've seen the proposal, and you've worked with them on it. Nothing includes fans.
No. At this point, it was all about the bubble format and having players. Yeah.
And would there be any provincial oversight of ensuring that the bubble is being adhered to? Any kind of inspections? Whether it was, just checking in, spot checking or anything else? Or is it being left completely up to the CFL?
Well, it's still, we've reviewed their plans, we provided some feedback for their plans, and we'll look at that, so, and we'll close the loop on that. So none of these things are off the table. We're certainly gonna wanna know how the plans are being implemented and how they're being maintained.
So you might have some oversight,
Yeah,
spot checks?
I sure wouldn't exclude that. We would certainly be in our place to ensure our orders are being adhered to.
If this happens, the CFL does come here, are players going to be tested daily? And I know there'd probably be an increase in testing period, but would the CFL be covering that testing, the costs of the testing, or would that be coming out of the $2.5 million that the province has set aside to help host the event?
Yeah, so for the testing, for the most part, the league's not going to be doing a lot of asymptomatic testing. It's going to be ensuring people are self-isolating. There might be testing early on to secure that bubble. But once the bubble is secured, there's not going to be regular testing. There's going to be testing should anyone develop symptoms. And then that would be a typical testing and contact investigation as we do anywhere else. So that would be done through public health.
So that would be at public health's cost?
Just like anyone else who had symptoms, yeah.
Also, going back to the colonies a little bit, all these are popping up at the same time. Were these all originating from one specific event where these three people from these three different colonies attended, and then they spread back to their communities, or why is this popping up all at one time, these three different colonies?
Yeah, so many of them are linked to one event. One of them is one of our non-epi-linked cases, one of the index cases. And so I believe that earlier I mentioned that one of the non-epi-linked cases was in Interlake Eastern. It's actually Southern Health, and this is one of them that's non-epi-linked.
Do we know if it was a wedding or funeral or just kind of a gathering? Or?
Yeah, well, it was a large gathering outside of Manitoba, and so and then one such case is non-epi-linked to one of the colonies.
Do we know where outside of Manitoba?
Yeah, it was in Alberta.
Does that give you concern that, looking at all the cases that are happening in Alberta now, that might be time to put a 14-day isolation period back in on returning from Alberta?
Yeah, I mean, we never close the door on any approach, and so we continually look at those. With that, we have to look at things like adherence to it when we have that in place, and just other implications for having these things. So whenever we look at our restrictions and we lift the restrictions, it's not about keeping them in place for just one more month or just 6 weeks, right? We're going to be dealing this for a year, for 18 months. So it's not about just hang on for a couple more weeks and then we can finally lift them. If we really want to close Manitoba, we're looking at closing Manitoba for a year. And so this is why we're saying we need to find ways to live with this virus, because we can't really contemplate a situation where we're closing Manitoba for a year.
Over the weekend, we've heard that testing in places like Winkler, there were long wait times, like 2 to 4 hours. People didn't have a place to go to the bathroom. So will the province be reopening testing sites that were initially closed down when the numbers were low?
Yeah, we're going to look at all those things. We had a jump in testing, a lot of it because of the clusters in certain regions. And so, we're going to base our the testing sites on the demand we see continually. So we saw it high this weekend. We'll keep looking at that. We want to ensure there's not any big
numbers from the clusters identified in the Hutterite colonies and some of these cases that are in the community.
Yeah, so we're going to see more cases from our clusters. There's a lot of contacts out there, and so a lot of people have been tested. A lot of people are self-isolating. So we're going to see more cases related to this. We're going to see more cases on other colonies as well, because there's other colonies that have had contact here. And so we're going to do what we can to ensure that these are isolated. And we just, with these various contacts, we want to limit any further transmission from the contacts too, so they should be self-isolating at this time.
I think we've talked about secondary attack rate before. What does that number look like in this case?
Well, in this case, it's too early to tell because we're still within the incubation period. So the secondary attack rate overall in Manitoba is about 14%. meaning about 14% of people identified as contacts later develop COVID. And in this cluster, it'd be too early, so because many of them are still in their incubation period.
I wanted to ask you about kind of information sharing as it pertains to clusters and large groups of cases. In the past, there's been instances where there was, connection to a dental conference, to the trucking industry, now to Hutterite colonies. I'm wondering if withholding that information is actually creating more speculation, more fear, or what is your approach and thinking behind releasing that kind of detail?
Yeah, so I mean, what we do is anytime we think that their Manitobans could be placed at risk and there's a benefit from them knowing any piece of information, we'll release that right away. And you saw that Friday afternoon. So anytime we're get information where we're not sure we could identify specific contacts and let them know, then we're going to let Manitobans know. Other than that, we're going to release the amount of information that we feel is necessary to do whatever we can to protect the privacy of cases and as well as avoid things like stigma.
I understand the balance between privacy and respecting the individual, but in these cases where we do have these larger group numbers, and over the weekend we see 6 cases announced, there understandably creates a little bit of anxiety and fear among people wanting to know what is happening. So I'm more so just wondering, why isn't that information being put forward to perhaps address the fears that Manitobans may have to target and counter that stigma that comes from that?
Yeah, well, I mean, it is a balance, and so sometimes when we release information, we have new cases. The only thing we'll know about those cases is what was on the lab rec, so we may not have a bunch of information to release at that time. And otherwise, it's Manitobans should rely on us to let them know if we felt there was a significant exposure somewhere. We're going to release that as soon as we can. We're not going to wait till the next day. We'll release it as soon as we can. But other than that, then the Manitobans, like we said, follow credible advice. Don't speculate where cases are. Go to our website, and we'll definitely let you know if there's a significant concern.
On the CFL case, you've seen the plan. How much virus would there have to be within the bubble to end the season?
So this isn't a specific answer. It depends. What we'll look at is that if we see interbubble spread, if there's evidence of interbubble spread, then this is going to be a challenge on how we approach this. So we've always said our definition of close prolonged contact is that 2 meters, and now CDC in the U.S. and us are changing from 10 minutes to 15 minutes just there. And so we've the CFL and us review things like game films and those criteria. There's actually very few people that meet that criteria in there. So if we have a single case, then we'll do our usual process. If we find anyone who we determine is a close prolonged contact, then they'll have to self-isolate. But we're putting a lot of measures in place to limit the possibility of that. But with evidence of interbubble spread, then it's going to be a real challenge to try to limit the amount of contacts we have to self-isolate.
Because what happens if you get to 10, 20, 30, 40 cases of interbubble spread? What happens?
That's going to put a real challenge on continuing with the season.
But whose call is it? Is it your call or is it the CFL's call?
Well, I mean, the call for a season would not necessarily be with public health, but public health would be advising of who needs to self-isolate.
But you could shut them down for public health reasons if it got out of
Yeah,
control.
for sure. Yeah.
I mean, at the end of the day, it's your call, right?
Yes. Yep. The public health would have that authority to stop that, and really even indirectly by the amount of self-isolation that would have to take place. It would be done through that usually.
Last couple of questions, guys.
Sure. As we see more cases come forward, are you going, and when you take into consideration overall test positivity rate, if our test positivity rate rises because of these clusters, are we approaching, factoring that, interpreting it a little bit differently moving forward?
Yeah, and so I mean, this is why we don't look at just one factor. We look at a bunch, right? So we see our test positivity rate climbing, getting to levels that we don't really like, but it's all related to isolated clusters. That's much different than if we saw our test positivity rate climbing with community-based transmission. So that's why we have many things we look at, and that's one of them.
So that might not necessarily trigger collection of like restrictions?
That's
or-
right. Yeah, not any one measure on its own.
Do you recommend the use of masks right now in indoor public places?
Yeah, I think that, I think if you can't assure physical distancing when you're indoors, then yes, I think it's a good idea to start using masks in those situations. And then I do think that as we move forward into fall with no doubt a respiratory virus season, mask use is going to be a much bigger aspect of our plan going forward. Certainly nowhere at the point right now where we're thinking about mandating anything. And really, if you look at our first sort of introduction of this virus here, Manitobans, for the most part, have followed our advice. So we may never need a mandate for that if we really strongly recommend it.
Do you think all these measures we're taking now might actually help mitigate some of the respiratory illnesses like influenza when that season comes? I mean, if we're all taking all of these precautions, is it logical to assume that that might actually help in mitigating the spread of the usual influenza cases that come?
Yeah, absolutely. These viruses are spread in much the same manner. Hand hygiene is really important. Physical distancing is important. Staying home when you're ill, very important with this. Every year we see many influenza outbreaks in personal care homes which have severe outcomes. This year we would expect that to be limited as well with our precautions.
When you see, with the growing anti-mask movement out there, how concerning is it for you that it's not just happening for masks, but that they're also potentially turning kind of the blind eye to other public health orders, and that these type of movements can breed further people into the groups, and it kind of spreads that way? How concerning are these types of movements for somebody like yourself in this position?
So we want to make sure that Manitobans are on board, and they certainly were on board for much of the measures we took till now. But this is a real important thing as to why we follow the least restrictive means. Why when our numbers are looking good and the epi throughout the nation is improving, why we look to reduce some of the or loosening some of the restrictions, because of that. We really don't want to promote this adherence fatigue or people just getting fed up with sticking to these measures. But when you have that stretch of zeros that we did, it's certainly human nature to lose some focus on what got us here. But these cases that we're seeing now are a reminder that this virus is still around. If we let our guard down, it could take off again.
Just to clarify on the quarantine rules for the CFL plan, you said there'd be possibly different quarantine time periods depending on where the player is coming from. Can we assume that it would be at least 14 days for anyone coming from the U.S.?
Well, it depends. We haven't landed on a final number like that, so I don't want to say this. It depends on how we're going to formulate that bubble, and so it's everyone's best interest to ensure that bubble is as solid as it possibly can.
Why would it be less than the 14 days?
Well, we look at a combination of the self-isolation period plus testing plus very close symptom monitoring, and then limited interactions in the other parts of that.
But it could be 14 for some.
It's possible.
A player coming from a hot spot like Florida or Arizona or Texas, South Carolina, you might say, well, we need 14 days for that player.
It's possible. We haven't finalized those type of things yet.
Okay, guys, better wrap it up. Thank you.